Are you an academic individual? If so, chances are you are suffering from low back pain. Thank you for tuning into our channel where we aim to give you, the patient, the most up-to-date evidence-based information. So let's start off with our main question. Do college or graduate students have more low back pain than non-students their age? Some of the other questions that we will be covering is, what is low back pain? What are the symptoms of low back pain? What causes low back pain specifically in students? How can low back pain affect academic performance? How can low back pain be prevented in students? What are some good exercises, and how can chiropractic care help with low back pain in student populations? Let's first start off by describing and defining what is low back pain. Low back pain is a common medical condition characterized by discomfort or pain in the region of the lower back. The lower back or lumbar region is made up of 5 vertebrae L1 to L5 in the spine. It is surrounded by muscular, ligamentous, nerve, and tendinous structures which all aid in allowing the normal movement of the spine. Low back pain can range in severity from mild discomfort to severe debilitating pain. It can be acute, meaning it lasting for a few days to weeks, or chronic, which is persistent from 3 months or lasting longer. So what are the symptoms of low back pain? There can be dull, aching pain. This pain is often localized to one side or may radiate to other areas such as the thighs, legs, or glutes. It can be a sharp shooting pain, which in some cases the lower back pain may present as sharp shooting or stabbing pain. This may be indicative of nerve compression or irritation. The third symptom is stiffness. Lower back pain can be accompanied by a feeling of stiffness or reduced flexibility in the lower back. This stiffness may make it difficult to perform normal daily tasks. The fourth symptom is muscle tension or spasms. These may contribute to discomfort and reduced mobility. The fifth symptom is pain with specific movements. These may include bending, lifting, or sitting for prolonged periods of time. So what causes low back pain in students? The first and foremost, as you know, prolonged sitting. Many students spend extensive periods sitting during lectures, study sessions, and while performing research. This can lead to poor posture and puts a strain on the lower back. The second mechanism is through ergonomic strain. Improper desk or chair heights along with inadequate support while sitting contribute to low back pain. The third mechanism is through stress and tension. Academic environments tend to put a lot of pressure on students, which cause them to experience muscular tension, particularly in the lower back, neck, and the shoulders. The fourth, as we all know, is inadequate sleep. Poor sleep quality or not enough sleep can exacerbate physical discomfort, including back pain. And the final is lack of physical activity. So how can low back pain affect academic performance? A study performed in 2023 observed how low back pain affected the academic performance in medical school students. The study found that low back pain reduced concentration, caused poor sleep quality, limited physical activity, and increased stress levels among the medical student population it observed. Another study looked at the prevalence of low back pain in distance learning during the COVID-19 lockdown. The study found that low back pain increased significantly during COVID-19, and pain intensity increased among individuals who underwent distance learning. The study found that there was also a large increase in psychological stress with low back pain. And here we have another study on how low back pain affected academic performance. The study looked at how insomnia impacted overall academic performance. The study found that there was a significant positive correlation between chronic low back pain and elevated insomnia levels. This shows us that low back pain causes lack of sleep and decreased quality of our sleep, which ultimately will impact our academic performance. The study also noted that during bouts of low back pain, the sympathetic nervous system is activated. Through research, they found that chronic low back pain leads to the overactivity of our sympathetic nervous system, causing an increase in inflammatory cytokines in the body. This increase in inflammatory cytokines has now been found to be associated with causing sleep disorders. So what are some mechanisms to prevent academic low back pain? The first is through ergonomic adjustments. You want to invest in a chair that offers proper ergonomic support for the natural curvature of the lumbar spine. The second for ergonomic adjustments is to ensure that the monitors in your workstation are set up at eye level. The second way is through physical activity. You want to make sure that you engage in regular exercise that includes cardiovascular strength training and flexibility. This will allow for maintenance of a healthy body weight and proper strength of the body's natural postural muscles. This can include core work as well. The third point is through adequate sleep. As we know, in an academic environment, the one thing that we tend to neglect, especially during finals, is to get an adequate amount of sleep. Ensuring sufficient sleep on a mattress that provides proper support is significant and will help aid your sleep quality. You also want to adopt a comfortable sleeping position using pillows strategically to help support the natural curvature of the spine. So let's come back to our main question. Do college or graduate students have more low back pain than their non-students? Do college or graduate students have more low back pain than non-students their age? As we now know, yes. So what are some stretches that can help reduce muscular-induced low back pain? Here we have a picture up above as well as a picture of the instructions on how to perform it. You can perform these while you're studying, while you're reviewing, just kind of in between or at the end of a long day. So how can chiropractic care help academic low back pain? The first is through spinal manipulation and adjustments. These help improve spinal mobility and improve the body's physical function. The adjustments and spinal manipulation can also help relieve pain and reduce nerve irritability responsible for inflammation, muscle tension, and other symptoms associated with low back pain. The second way that chiropractic care can help with academic low back pain is through manual therapy. Manual therapy targets the soft tissues and joints. This includes manual muscle stretching, resistance techniques, therapeutic massage, and trigger point therapy to help reduce pain and improve function. The third way that chiropractic care can help with academic low back pain is through exercise and rehab. Many chiropractors will prescribe specific strengthening exercises for the lower back. These exercises are designed to help improve posture, strengthen the muscles supporting the lower back, and decrease overall reoccurrence of pain. And the final way is through patient education. Chiropractors will often educate patients on how to properly take care of their backs. This usually involves education through healthy habits such as proper lifting techniques, body mechanics, and routines that help keep the spine healthy. And that's all I have for the presentation today. I hope you found this video helpful and informative in guiding you on the best way to get your low back pain taken care of, specifically in an academic population or environment. If you found this video helpful and informative, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you and have a wonderful day.